everyone, welcome back to my channel, Learn with Riyaa. Today we are going to be learning about a very important topic, colon cancer. But before we get started, I would just like to say that all of this information is taken from the CDC. Before I go over all the details of colon cancer, I would like to share some statistics to emphasize its importance. Firstly, in the US, colon cancer is the third leading cause of cancer-related deaths. Also, about 52,580 deaths from colon cancer is expected in 2022. This shows how prevalent this kind of cancer is in our society and how important it is to learn about it so that we can prevent ourselves from getting colon cancer before it happens. Before I get into the details of this presentation, I would like to give you guys an overview of what I will be discussing. I will go over what colon cancer is, symptoms and signs, risk factors, primary prevention, secondary prevention, and tertiary prevention of colon cancer. I go into a lot more detail on what primary, secondary, and tertiary prevention is in another video. So if you want a refresher or you just want to learn about them, you should definitely go watch that video. Let's get started. What is colon cancer? Colon cancer is the uncontrollable growth of cells in the colon or rectum. We know that cancer is just the uncontrollable growth of cells. So when that happens in your colon or rectum, that's just colon cancer. Here's a diagram to show exactly where the colon and rectum are, just so it's easier to understand. Also, polyps or abnormal growths can form in the colon or rectum. This can then later turn into cancer. Now that we know what colon cancer is, what are some symptoms and signs of it? One symptom is blood in stool. Another is if you experience diarrhea, constipation, or feeling like the bowel does not empty all the way. Another sign includes persistent abdominal pain, aches, and cramps. Lastly, if you experience sudden weight loss that's not planned for, that can be a symptom or sign for colon cancer. What are some risk factors for this kind of cancer? One is a genetic syndrome such as familial adenomatous polyposis, otherwise known as FAP, and Lynch syndrome. Also, if you have a diet low in fruits and vegetables, this can increase the risk for colon cancer. Others include tobacco use, lack of exercise, inflammatory bowel disease, alcohol consumption, and even a family history of colon cancer. Now, you might be wondering, well, what can I do to prevent myself from getting colon cancer before it even happens? One thing you can do is adopt a diet low in animal fats, but high in grain, fruits, and vegetables. All this is very good for your body and can reduce the risk for cancer. Also, some people may take low-dose aspirin as it can reduce the risk of colon cancer, but this also depends on a person's age and their risk factors. So it just varies from person to person. It is very important to go to your doctor for your checkups. Never miss those. And adults aged 45 to 75 years should start getting screened for colon cancer. One kind of screening is actually called flexible sigmoidoscopy. And doctors check for polyps or cancers in the rectum and lower third of the colon. And it's recommended that it should be taken every 5 years. Another screening method includes a colonoscopy. In a colonoscopy, doctors check for polyps or cancers in the rectum and all of the colon. It should be taken every 10 years. Lastly, there's a CT colonography. And in this, doctors use x-rays and computers to produce images of the colon where they can see if there's anything abnormal or if everything is normal. This should be taken every 5 years. Unfortunately, some people do get colon cancer, but don't give up because there are many treatment availabilities, including surgery, chemotherapy, and even radiation. That's it. Those are the basics and fundamentals of colon cancer. And I hope you guys learned a lot from this presentation and learned the significance of colon cancer. I hope you also understood how you can prevent it before it even happens. Thank you so much for watching this video. Please leave a thumbs up, subscribe below, and also, please leave any comments of any questions that you might have or any other videos that you would like to see. Thank you so much, and I will see you guys next time to learn something equally as important and intriguing as colon cancer. Thank you. Bye.